Well, people who rely on drugs like Ozempic for diabetes and obesity are facing major obstacles getting their medication, especially low-income earners. Rising prices, insurance hurdles, and a supply shortage are often standing in the way of their health. So Renu Rayasam joins us now to talk a little bit more about this. She is a senior correspondent for KFF Health News. So Bernie Sanders is really going on and on about this. And one of the things that he said was, it's about $1,000 for Ozempic a month. Here, just over the border in Canada, it's about $100. Walk us through why it is so expensive to get your hands on these drugs here. What's contributing to this?
Sure. So this whole category of drugs known as GLP-1 agonists, which includes Ozempic and Mounjaro, these diabetes and weight loss drugs, they cost anywhere from $900 to $1,300 a month in the U.S. And that's for any number of reasons. That is what drug makers say they're charging because of market conditions and inflation and the cost of making it and marketing these drugs. But as Senator Sanders pointed out, U.S. consumers and insurance companies pay so much more for drugs, 10 times more in this case, than residents and insurance companies in other countries. And one big difference in the U.S. compared to other countries is that the U.S. government doesn't negotiate drug prices here, and many other countries do.
Yeah, just a key difference. Canada, as an example, it's a national healthcare system. So, yeah, you're right. The government is negotiating for the whole country. But is there also a shortage when it comes to these GLP-1 medications?
Absolutely. So one thing to note is these drugs have been approved for diabetes for many years, and there weren't shortages when they were just approved for diabetes. But a few years ago, the FDA approved these drugs, the compounds in these drugs, I should say, for weight loss. So it's the same drug, same compound as in Ozempic, but there's a weight loss counterpart, and the FDA approved those for weight loss. And once that happened, demand skyrocketed. And in March, the FDA approved the same compound that's in Ozempic to also treat heart problems. So these drugs are really powerful. They have tons of uses and health benefits, and demand has skyrocketed. JP Morgan estimates that 30 million Americans are going to be on these drugs by 2030. That's 9% of the entire U.S. population.
So what do the experts in this field say is the solution? How do we solve this?
That's a good question. Senator Sanders has called for an investigation into why these prices are so high. Drug makers are scrambling to keep up with the demand, and insurance companies, also have their thicket of rules here. This is really a story about the complexities of the U.S. healthcare system, and there's not going to be one silver bullet that's going to solve this. I think it's dealing with all the different ways of how we manage healthcare in the U.S.
All right, Renu, thank you so much.
Thank you.